In this video, I will talk about topic the positioning principles with subtopic evaluation criteria. Okay, before we start discuss about this topic, let me introduce myself. My name Alfian Akhsanudin. I'm from class 1C and my study program is Radiology Imaging Technology before. Okay, at first I will talk about evaluation criteria. Evaluation criteria is the goal of every technologist to take an optimal radiograph that can be evaluated by definable standards. And this we have an example of four-part radiograph image evaluation as used in this text for lateral forearm is shown in the right. We have two pictures, that is the positioning photos and the resulting optimal radiograph. Second, we will talk about evaluation criteria format. The technologists should review and compare radiograph using this standard to determine how close to an optimal image was achieved. A systematic method of learning how to critique radiograph is to break the evaluation down into these four parts. And the first part is anatomy demonstrate. Anatomy demonstrates describe precisely what anatomic part and structure should be clearly visualized and that image or radiograph. The second part is position. It's generally evaluate for issue. First is placement of body part in relationship to IR. Two is positioning, factors that are important for the projection. Three, correct centering of anatomy, and four is collimation. Okay, and the next part is exposure. Exposure describe how exposure factor or techniques like a GV, MA, and time can be evaluated for optimum exposure for that body part. No motion is a first priority, and a description of how the presence or absence of motion can be determined is listed. The fourth part is image markers. A fourth area of evaluation involves image markers, anatomic site markers, right or left patient position or time markers must be placed correctly before exposure so that they are not superimposed over essential anatomy. We have an example about evaluation criteria. We have a four part of evaluation criteria, and the first we have anatomy demonstrate. This is show anatomy structure from antebrachial and disposition. We have a lateral projection from antebrachial, and the exposure we have optimum density and contrast with no motion and image marker. And here we have a right marker or R marker. And that's all. Thank you.